Well, I wanted to take a minute to not only introduce myself, I'm Louise Bodenstein. I wanted to let you know that I am with American Senior Care. It is a home health organization that is based strictly on skilled nursing services and therapies. And I just couldn't be more proud to be part of this team. So I want to first introduce Jill Rowe, who is going to do the presentation today, and knock 'em dead.
So I'm going to start with some of the basics, just a little bit about our company that makes us a little different from some of the other companies. We are owned by clinicians. So our company owners are a physical therapist, an occupational therapist, and a nurse, and a vice president of marketing. The nice thing about that is that if I have questions and I can't find the answer with Louise or Darlene, which most of the time they have all the answers, but if they don't, I can pick up the phone and get one of those 4 people to get an answer. That's good for patient outcomes. That means that I can get an immediate answer for a question that I have. Louise talked about our start of care. We almost always start care within 24 hours, sometimes the same day. It really depends on the specific situation. And the final thing that we have that I think makes us stand apart from the competition is specialized disease programs. So if your patient or someone that you're working with has a specific disease, likely we have a specific answer. We can tailor those answers to their individual needs. But the nice thing is that we really do have an idea of what's going to help the Parkinson's patient. So we'll talk a little more about those programs as we go through the presentation. So who pays for home health? Any patient with Medicare. It's covered at 100%. So if you have a patient with Medicare or know somebody who could utilize those services, it's covered. Medicaid, private insurance carriers, the Veterans Affairs Office, workers' compensation, and the patient or their family if they don't have insurance. We also do charity work, so certainly if you have questions about whether or not we accept the insurance or we'll take it, you want to just send us the referral. We'll work on getting it covered for you one way or the other. Medicare guidelines for coverage. You have to be an American citizen, age 65 or older, disabled or have a chronic renal disease. Your home health has been prescribed by a doctor. You have to be homebound. And your condition needs to require intermittent skilled nursing, physical therapy, occupational or speech therapy. And what are some of the outcomes of using home health? Well, certainly we're going to shorten hospitalizations, shorten recovery time. You're going to get professional care from our office. We have Pat, who answers the phones primarily, and she's our intake coordinator. So when you call our office, that's Pat. Please say hi. She has probably the most stressful job because she gets all of the frantic calls from me. A team approach. So we have a meeting every Thursday. All of our clinicians are in the room working on what we can do to make the best outcome for our patients. Privacy and comfort, family-centered care, and client education. And now we're going to spend a little time talking about our specialty programs. So anodyne therapy is something that we use at American Senior Care in conjunction with physical therapy. So it has to be ordered with physical therapy. But if you all know somebody who has poor circulation, anodyne therapy is for them. Chronic pain, maybe they're calling frequently or they're just saying, I don't feel well, it hurts, it hurts. Anodyne therapy may be for them. Anodyne therapy uses monochromatic energy, and it's in an infrared form, and it's going to be FDA cleared to increase circulation and decrease pain. So it's amazing, the results that I can show you, and if you're interested, we can do something one-on-one where I can show you results where patients have had outcomes that are phenomenal. Anodyne therapy is probably my favorite program that we offer because I've seen the results firsthand, and for me, that's something that I like to be able to say that, yes, I've seen the patient before and I've seen the patient after, and that makes me quite happy. We have a cardiopulmonary rehabilitation program. And we also have on its way a brand new CHF program. So we'll want to get you all educated about that CHF program just as soon as it's launched here. The Transition Home program, another program that I use quite frequently. This program includes a home health aide in the home daily, 5 days a week for the first 2 weeks. And what that does is get them from the skilled nursing facility home, gives them time if they're going to get community-based care or personal care in the home to get that set up. So observation and assessment, you know, patients who just need to be observed and assessed, we have that program. We can help you with that. Fall prevention. One of the neat things we can do is a Tenetti screening, which helps us measure how high of a risk a patient is for falling. By doing that screening, we can then identify high risk, low risk, moderate risk, and if they fall in the high risk category, send off the results to the doctor's office and get orders for physical therapy and reduce that risk. Orthopedic and joint replacement and our Parkinson's rehab. All of these I could probably speak for about 30 minutes on each one, but in the essence of 2 minutes, probably, I'm going to keep on going. So what I really want to just take the time to do is answer your questions that are specific. If you have things that you want to know about American Senior Care, certainly let me know. Louise is here to answer the ones that I don't know, which is great.